Back again with this week's video. This week we're going to learn how to use a lancing device and a blood glucose meter. But most importantly, I'm going to teach you some really useful tips that everybody should know. So, this is my lancing device. They're used to obtain a sample of blood, usually from the finger, for our blood glucose meter. Here's the first tip. Wash your hands with warm water and normal soap before you begin, and make sure you dry them. Now, warming your hands gives the puncture site better blood flow, so it's easier to collect a sample. Rubbing your hands also helps with this. To load a lancing device, it's pretty simple. You first twist this cap off, then you get yourself a lancet that hasn't been used, pop it in so that the grooves are in line. Next, twist this cap off, and now the needle is visible, so please be careful. Next, get this cap, pop it back on, twist it on, it should click, and that's it. Tip 2, use a new lancet every time you use your lancing device. I know it's time consuming, but remember this, every time you use your lancet, the needle becomes dull, so 1, it's going to hurt more, and 2, you're at risk of a skin infection. Next is the depth indicator, which is the thing that I'm twisting here, and it adjusts just how deep the lancet tip will go into your finger. Now, this isn't something that I can teach you on a video, you'll have to do it a couple of times to get the correct setting for yourself. Tip 3, this is what we call the pad of the finger. It has more nerve endings compared to the side. So for less pain when using this, go for the sides and switch fingers regularly to prevent thickening of the skin. If you're still in pain when you're using this, then speak to your healthcare professional about getting thinner lancets. And lastly, pull the sliding barrel back so it locks into place the spring-loaded lancet that we fitted earlier. Place it on your skin firmly and click the button so it releases the lancet to puncture your skin for the blood sample. So often I see patients' blood glucose meters and their control solution has never even been opened. If you're not testing your machine or your test strips, how can you be sure you're getting the right readings?
Do you want me to do your next scene?
Sure. So tip 4 was meant to be done by Lewis in the last scene, but he couldn't remember his part, so I'll just have to do it. So perform a control solution test each time you open a new vial of test strips, or you feel like your meter isn't working properly. Let's say it's giving unexpected results, or you may have dropped it or damaged it. Now, I've left more information in the description below about this. So, continuing on from our lancing device part, to test our blood glucose, we need to get a few things ready. So we need a glucose monitor, its specific test strips that are in date, a primed and ready to use lancing device, which we did earlier, a cotton wool pad, a yellow sharps bin, and a monitoring diary so we can put our results in at the end. Next, remove a test strip from the vial and insert it into your blood glucose meter. It should switch on at this point and warm up, and it will tell you when it's ready for your blood sample. Now, a word of warning for the next scene, there will be a little bit of blood, so if you don't like the sight of blood, skip forward maybe about 30 seconds. I'll put the information in the description too. Now let's do it. Place the lancet device firmly on the side of your finger, press the release button and remove the device from the puncture site. Warming up your hands makes it easier to get blood without applying pressure. If necessary, apply very light pressure to the surrounding area until a blood drop appears. Now wipe away the first drop of blood with a clean cotton swab. With the second drop of blood, be careful not to smear it, make sure your meter is ready and gently touch the blood drop with the test strip to collect a blood sample. The test strip will draw the blood towards itself. After a few seconds, the meter will display your blood glucose level. Write this down with any other information in the monitoring diary or update your electronic records. Tip 5. Diabetic patients tend to build up a collection of different blood glucose meters over the years. But it's really important to only ever use one blood glucose meter to build up a trend of results. If you're going to use different machines, you're going to end up with slightly different results, and that's not a good thing. And that's how it's done. One last thing before I go, make sure to remove your used test strips and lancets and put them in your yellow sharps bin. The safest way to remove your lancet is by placing the lancet cap on a hard surface and pushing the lancet needle into it. Now it's no longer exposed and easy to remove. So let me know how you get on with my guide by leaving a comment below because I'd love to read it. Thanks for watching. Hey guys, thanks for watching this week's video. Make sure to click that like, follow or subscribe button now to stay up to date with new weekly videos. Tip 5. That's it. A yellow sharps bin and our monitoring diary to input our results in. Who says input? Testing your glucose meter or your test strips, how can you be sure that the phone isn't going to ring?